Hello again, and we're sure glad you're with us for HealthWise the TV show. I'm your host, Ralph Hipp. With the colder weather we have coming, come increased cases of colds and flu and respiratory infections. A very good friend of our show, Mike Conlin of Jayhawk Pharmacy and Patient Supply is with me today. We're going to share some strategies with you for staying healthy this fall and winter. Mike, it's always great to see you.
Good to see you, my
Always a pleasure. Well, we have a CPAP machine here. That's where we start, and then we'll go to COPD later on. CPAP is continuous positive airway pressure, the CPAP machine, and we have a dandy right here. So for CPAP machines, how often should we clean our masks and take care of our equipment? That's a common thing that we may say, I thought it was every couple of weeks or so, but there are some things we should do every day.
Really routinely, you should use soapy water, mild soap and water, warm, to clean your mask and the interface or the seal that comes up to your skin. If you think about it, the amount of germs that are on our skin, the germs that we breathe in and out every day, every night as well. And then if you have respiratory infection this time of year, it's being so cold and not very nice to be out, we're more prone for respiratory infections. And if you think of not cleaning the device, then you're just reintroducing those bacteria and germs to your body.
Talk to me a little more, Mike, or if we contract pneumonia or we have a respiratory infection, or can people with COPD have a CPAP machine as well? But the circulation of all those germs in and out for all night of sleeping. Talk to me more about that.
Well, it's remarkable. There's filters that you need to change very regularly just for the air. Even though we keep a house clean, we think there's always particulate dust in the air that gets caught in the filter. But if your filter's dirty or you don't use a filter, then you're going to inhale that dust. And it's just so important. People with COPD anyway, have difficulty breathing just routinely. In the winter and in the summer is typically when we see COPD at its worst. So we're going into winter now. When it's cold,
back into that,
it becomes much more difficult to breathe anyways. So I'd encourage anyone, whether it's you and myself or someone with COPD, to be very diligent about cleaning their device and the hoses and the like.
Okay, so Mike Conlin, along with fabulous Paige Conlin at Jayhawk Pharmacy Patient Supply. Paige, would you call her the CPAP specialist of the dynamic duo here?
I would say the CPAP queen would work.
The CPAP queen? Oh, I like that.
She's
absolutely
very good with people.
She's been very good with me. I know. I come and see her. I have it too. The list from the tubing, the filter, and the masks should be replaced completely every 3 months.
Yes, sir.
Right? The headgear and the chin strap right in here. So those are good for 6 months.
Exactly.
Along with even your water chamber and your filters. Have the new filters stocked up every 6 months as well.
Exactly.
Yeah. So it's especially important as we're coming into the winter season. And would we even want to replace those supplies more often over the winter?
I would certainly encourage people to do,
yeah.
and quite frankly, this time of year, a lot of people do that. They've met their deductible, and it's an opportunity for them to get a little bit ahead on supplies. So that if, for example, you travel, in my case, I have everything ready to go so that all the supplies are in one spot instead of at the last minute panicking and trying to make sure you have everything put together for your trip.
Mike, last time you were on the show, you brought a device of your own called a SoClean. There's a lot of advertising nationally. I think people know the name SoClean, where you would pop it off the tube, and you'd put it in the SoClean and close the door. How is the response to SoClean, and is it proving to be very effective in what we're talking about?
It's 99.99% effective in killing bacteria and viruses. So
you have that?
Yes, and it's just remarkable. The acceptance has been beyond anything that I've seen in my, frankly, in my 40 years of being a pharmacist.
Well, I definitely want to ask about that.
Simply just put the device, your mask in, close the lid, the ozone goes through the entire system. A lot of us will leave our water in the chamber and it gets a little yucky. And it sterilizes that as well.
Here's something a bit heavier than a CPAP machine. You grab one side of that, Mike, and I'll hold the other. So this is an AFlow Vest, and tell me more about what this does. This is for our patients at home with COPD. And they wear this and can take it around. It's fairly heavy, though.
It's fairly heavy, but it makes it such that you can get around. Previously, the history of devices like this is that they have a big, long umbilical cord almost that goes to the compressor. This is all self-contained for people that have chronic obstructive pulmonary disease. About 50% of those individuals suffer from something called bronchiectasis, which is that cycle of infection, fluid buildup, mucus, scarring, and just the repeated antibiotics over the course of the winter or their sickness.
Right.
And this actually serves as a percussive device.
Uh-huh.
So many of us have thought of children in the past with cystic fibrosis, where you may think of the parent galloping, if you will, on the child's back, and it just cuts the mucus loose.
Okay, so call for the AFlow Vest and the SoClean, a couple of new products on the market to help you out. In the few seconds we have, we're going to do a little exercise for you in just a moment. Mike, tell me one of the misconceptions we have about flu and colds in the wintertime.
It's difficult to predict. Flu vaccines, flu shots, we always recommend that people do it. And unfortunately, it's a best guess by the manufacturer as to what's going to be the virus this year.
They hope to have all the strains covered in the vaccines that everybody gets.
And that's where we're hopeful, you know, along with a pneumonia shot that's recommended for folks. You can't go wrong in doing that, and it's just a wise tale as to whether or not you get the flu when you get a shot.
Okay.
So I'd encourage everyone.
If you have a question for Mike and Paige Conlin, we encourage you to stop by Jayhawk Pharmacy. They're not too very far from Hummer Sports Park. That's a good marker there. 235-9700 at jayhawkpharmacy.com. So we talked about your CPAP machine, cleaning those more often, not only in the summer, but now we're coming into the wintertime, and the AFlow Vest we talked about if you have COPD. Michael, thank you very much, and tell Paige hello for us. It's always great to chat with you and keep us healthy.
Have a great holiday.
You too. Great holidays for you and Paige. Coming up, our HealthWise TV exercise segment, some fun, invigorating, low-impact exercises. Check with your doctor before you start this or any other Topeka exercise program.